right. So a lot of patients come in with, especially after an MVA. What's an MVA? Good question. A motor vehicle accident. A lot of patients come in with whiplash. We're going to take a couple minutes and talk about that. It's a kind of a wide, and it has a wide spectrum of injury, let's say. My name is Dr. Walsh. I'm here at Walsh Chiropractic and Physical Therapy in Hagerstown. And we're going to jump into this whiplash. Whiplash can really range depending upon the force. Now, to begin with, what is whiplash? It is a sudden whipping of the head, forward, backward, backward, forward, side, side. Doesn't matter. The problem is, because of the force is so great, and it doesn't take a lot of, well, the guy was only going 5 miles an hour. Yeah, but that's 2 tons coming at you at 5 miles an hour. And F equals ma, the acceleration part of that physics formula is the acceleration of your body from zero, not moving, relative to snapping. Okay, it's a lot of force. And in that, a lot of varied tissue can be damaged, all the way from fractures of the spine. Even like here, if you whip too hard, too quick, too strong, you're going to start to fracture the vertebral bodies. You're going to tear ligaments. Okay, you can damage discs depending upon how hard. Other tissue that you don't even, muscle tissue, big muscle tissue in the cervical part of the spine can be damaged. Typically what happens is it's that whipping of the head and you tore tissue. How bad did you tear it? Depends. The more force that your body has to deal with, because that force is coming in and out of you quickly. And what happens is that force is so strong that it moves your body for you. You're not moving it, it's moving it, and it's working its way out of you, right? When it goes that kind of quick, tissue is going to be damaged. And the faster the vehicle had gone to hit you, the more damage can happen. Or the vehicle that you're in, you hit, same thing. So what it is it's the way that the body deals with the force presented to it at that moment in time. And the level of injury can vary severely. You can tear arteries if it's too forceful. But typically what you're doing is you're tearing ligaments in the spine, the ALL, PLL, the yellow ligament. Those are gone. Usually little muscles along with it. Not so much, depending upon the greater the force, the larger the muscle that's going to be torn. Now, what's funny about this is you can have support of level of injury in an x-ray. How so? Good question. Because when you do have an injury in whiplash, you can tear the ALL, PLL, and the yellow ligament back here. And it's these you have a natural curve. Now, this is not a natural curve. A natural curve is a lot more, right? Because the ear is usually going to be over the bottom of the cervical spine. That's the right amount of curve. But in a x-ray post-whiplash, where those ligaments were torn, you have no more cervical curve, or you have what's called an interior curve. It goes the other way. Now, there's a reason why your body is the way it is and supposed to be, is because for a reason. If any variation, the more you come off of that, the more problems that you're going to end up having. Because the reason why you have curves in your spine when you look from the side is to help deal with forces, right? So if you have a curve that's less than optimal range, it's not dealing with the forces correctly. So what happens is you're going to degenerate quicker, right? Because the forces accumulate on joint. And then if you have it even reversed curve, what's called a reverse curve, there's a lot of problems. You're going to end up with degenerative disc, degenerative joint in that part of the spine. And that goes for the whole spine too. Whenever it comes off of, the further away from norm it gets, the more problems you're going to end up. Now, this gives you problems because you no longer have a cervical curve. The ligaments were torn, they're injured, right? Can you ever regain that back? Yes, you can. Is that 100%? No, it's not. Can we improve? Yes. So typically what happens after that is, of course, if you have that kind of injury, usually you're going to have other things. And typically, the worse the whiplash, you're going to have other injuries. And you're going to have seatbelt injuries where they dug into your shoulder, your sternum, your waist, the hip, depending on what chair you were in, passenger or driver. Low back also. You can have what's called a seatbelt fracture in the spine, where the seatbelt held part of the body back in the force of the impact. So the vertebral body kind of shears in half, okay? These are all possibilities in a motor vehicle accident. So typically what we do is, if they have a severe or even mild to severe, and even the age of the patient or the health of the patient too has a lot to do with this too. So it's more going to be more than just in the cervical spine where the problems are. But typically what we do is, number one, we don't want to stress the system too much because they don't have the stabilizing ligaments to hold the cervical spine. It's not like, well, sometimes you do see people in braces. So this is a wide varying to where you can have minor tears and soreness for a relatively short period of time, a month, maybe two, to a long. This is why insurance companies hate this, because soft tissue injury and soft tissue injury, it varies from person to person, to be honest with you. And no doctor can tell you, oh, you're better, because you're not. You know what I mean? They don't know. It varies. Even though tissue may be visually looking like it healed, it hasn't. It's a long time. And a lot of it is connective tissue, so they're avascular. It takes a lot longer, you know. Typically, I don't see issues with the spinal cord in an MVA because that's a lot of force, or that is a lot of head movement with that. But you do typically see the ligaments injury, and you can see some minor muscle injury, and even some bone injury, some bone bruising actually. Typically what we would do is we would evaluate. We would get x-rays right away. In fact, usually if it's that bad, you want to go straight to the hospital right after the MVA. And that's what I recommend you do, because now we need to set up a baseline, right? That gives me a baseline. You can go to the hospital, they're probably going to take x-rays. They may give you some muscle relaxers, painkillers, whatever. But that doesn't mean don't come here. What that means is get treatment here, because you need a lot of healing. And what we're trying to do is bring back that curve and have it heal in the curve. How do you do that? Good question. Well, through adjustments, through exercise. Typically, you don't do any stretching right off the bat. We just want to adjust you, get those tissues to relax, get you stabilized as quickly as possible. But that's whiplash. It's actually very serious. It really is. And I've had a number of people that had an accident and they walked away, nothing, didn't bother me. But a month later, it starts now. And that can be too. That's why insurance companies hate it, because you could have a delayed reaction to the trauma. Okay.